Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Rosuvastatin, also known as Crestor. So what is Rosuvastatin and how does it work? Rosuvastatin is a prescription medication that belongs to a group of medications called statins. Statins help to reduce cholesterol, notably bad cholesterol or LDL-C. If you're diagnosed with high cholesterol, your healthcare provider will typically recommend changes to diet and exercise first. If that doesn't work, then statins are your first line of defense. Rosuvastatin, like other statins, work to reduce cholesterol by lowering the amount of cholesterol your body makes by blocking an enzyme in your liver called HMG-CoA reductase. Rosuvastatin is considered a moderate to high-intensity statin, depending on the dose you take. Rosuvastatin is available in 5, 10, 20, and 40 milligram tablets. At the highest dose, patients can expect up to a 55% reduction in bad cholesterol. If you have high cholesterol, why is it important to take Rosuvastatin? Well, it's important because over time, bad cholesterol can accumulate on the sides of your blood vessels and decrease blood flow for certain organs, like your brain and heart. This buildup is commonly referred to as plaques, and when these plaques rupture, this can create a medical emergency known as a heart attack or stroke. By lowering your cholesterol, Rosuvastatin helps to reduce the buildup of plaques, which reduces a person's risk of developing a heart attack or stroke. This is particularly important for people who have multiple risk factors for heart disease. When is the best time to take Rosuvastatin? It doesn't matter when you take Rosuvastatin. You can take it at any time of the day with or without food. As a general rule, I do recommend that you try to take the medication at the same time each day, as it's much easier to remember to take it that way. What if you miss a dose? You'll want to take it as soon as you remember to, as long as it's less than 12 hours before your next dose. If it's past that 12-hour mark, skip your dose and take it at your next scheduled dose. So what are the side effects of Rosuvastatin? Like all medications, Rosuvastatin has a few side effects. Some common side effects include headache, cold-like symptoms, trouble sleeping, nausea, heartburn, abdominal pain, indigestion, constipation, and muscle pain, including joint pain. If you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. What should I avoid while taking Rosuvastatin? Antacids made of aluminum or magnesium can reduce or slow down the absorption of Rosuvastatin. If you're using this kind of antacid, it's recommended to wait at least 2 hours after your Rosuvastatin dose before taking it. Does Rosuvastatin interact with other medications? Short answer is yes, it can. Always talk with your healthcare provider and tell them about all medications, supplements, or vitamins you may be taking. Importantly, Rosuvastatin is processed by our body through an enzyme called CYP2C9. This enzyme is part of an enzyme family called cytochrome P450, and this family of enzymes is responsible for processing nearly 70 to 80% of all drugs on the market. As a result, there are risks of taking Rosuvastatin with other medications. Are there any special considerations for certain races with Rosuvastatin? In clinical studies, it was found that people of Asian descent have high levels of Rosuvastatin in their blood after they take it. This is due to a certain genetic difference. As a result, the FDA does recommend that Rosuvastatin dosage be reduced in Asian patients. Like all medications, you should speak to your pharmacist or healthcare provider about any questions you may have. There's lots of information on high blood pressure, cholesterol, and other cardiovascular treatments on our website. Check out our blogs in the links below. Goodbye for now.